I'll go ahead and get started now. Hi, everyone. Welcome and thanks for joining us for today's Che Alaska webinar. Today, we're going to be having a discussion on chemicals found in plastics and their impacts on human health, and also how the Global Plastics Treaty could help address this public health crisis. So it's a very timely conversation with upcoming INC4 negotiations happening in a couple of weeks. My name is Sarah. I'm the communications coordinator with Alaska Community Action on Toxics. And before I go ahead and introduce our speakers, I want to note that Che Alaska is a program of ACAT and Collaborative for Health and Environment, and it's also part of Che's broader international coalition of over 5,000 individuals across the globe. So if you have any questions during the webinar, please feel free to send them in the Q&A box at any point. And at the end of the webinar, we'll address any questions. And we might go slightly past the hour to get to the questions, but we'll try to keep it to an hour as we have scheduled. So we have two great speakers joining us today. We have Dr. Tracey Woodruff. She's a professor at UCSF, and she's the director of the Program on Reproductive Health and the Environment. And she'll be presenting her recently published review article highlighting the link between the growth of the petrochemical industry and the rise in many diseases, especially reproductive cancers in women. And we also have Dr. Laura Monclús Anglada. She's a researcher with the Norwegian Geotechnical Institute, and she's going to be talking to us about the recently published State of the Science report on plastic chemicals that she co-authored for the PlastChem project. So we're excited to have you both here for this important topic. And now I'll go ahead and hand it over to Dr. Woodruff to start us off.
It'll be better if I turn off my mute. Thank you so much for inviting me and for participating in this Che webinar. And I have nothing to declare. So I run the Program on Reproductive Health and the Environment, as well as the Environmental Research and Translation for Health Center. And these programs are dedicated to healthier environments for healthier people by targeted research, improved clinical care, and just public policy. And I have nothing to declare in terms of financial conflicts of interest. So I am going to talk about an article I recently published in the New England Journal of Medicine, which is about how fossil fuels are driving our exposures and subsequent health effects of endocrine-disrupting chemicals. And I wanted to note that what was, I think, really an important marker of this is that the New England Journal of Medicine is the world's leading medical journal, and they have been published continuously for over 200 years. And so I wanted to, just before I get into what it says, talk a little bit about how this represents a really important milestone in our collective action to improve the recognition of environmental chemicals as a driver of health risks. So this has been, this work has been, the article represents a lot of years of work, including with the Collaborative on Health and the Environment. And previously to, and I wanted to note that a lot of the work started in 2007 when we hosted a summit on reproductive environmental health. And prior to that, there had been some very foundational books published in the field, including from Theo Coburn and Pete Myers and Ted Shetler on EDCs and health effects. But really, a lot of this work started to accelerate starting in 2007 with a lot of important aspects that formed the foundation for this work that was published recently coming from the summit, including a lot of work to engage health professional societies, such as the American Congress of Obstetricians and Gynecologists, the International OBGYN Society, the Endocrine Society, all have issued opinions about the importance of environmental risk factors on health, along with improved methods that we've developed at UCSF for how to evaluate evidence that provides a more closely aligned with how clinical medicine evaluates evidence and provides a more rigorous and comprehensive evaluation of evidence with a bottom line summary. And those two streams have helped embed environmental chemicals as a risk factor in the healthcare field, which I think is representative of this New England Journal of Medicine article. So the leading cause of premature death globally is pollution. 9 million deaths annually. Air, water, pollution from lead and other chemicals, and other toxic occupational exposures are the leading cause of premature death. This has actually been published in 2 separate articles in the Lancet. And I will note that total pollution, that's secondhand and smoking is close behind, is over 3 times greater than AIDS, tuberculosis, and malaria combined. And of this total, chemical pollution is over 1.8 million, contributes over 1.8 million premature deaths. But this is likely underestimated, which I'll talk a little bit more about, since most of the chemicals that are produced and used in commerce, we actually do not have the data to adequately characterize exposures or health risks. And that is largely due to, or mostly due to, insufficient laws that require the kind of data that we need to understand and address health risks from toxic chemicals. So the other component of this is that chemical pollution is driven by the extraction, production, and use of fossil fuels, coal, oil, and gas. And what's important about this is that there's a tight link because fossil fuels are also the primary driver of climate change. So fossil fuels make up the feedstock for most of the plastics produced in the United States, which is an important feature of what we're going to be talking about, especially as it relates to the plastic treaty. And approximately 25% of the crude oil produced in North America is used in petrochemical production, primarily ethylene, rather than for transportation or fuel. And I think what's really interesting about this is that the production of ethylene, which is used in the many of the types of chemicals that I'll be talking about today, is as a feedstock for chemicals is more lucrative than the sale of methane and ethane for fuel, heat, or electricity. So you can see right here that as the natural gas as a component goes into these intermediate plastic-related products, and you can see that those are then turned into the many and various consumer products that we are using in our daily lives, whether it's in our home, food packaging, clothing, tires, adhesives. And I just want to point out that ExxonMobil, which you probably know is a large seller of fuel, is also one of the largest sellers of plasticizers. So the end result is there's about 30,000 pounds of industrial chemicals that are produced each year in the US for each person. That's about 9 trillion pounds of chemicals produced in the United States, which is really mind-boggling. And most of these chemicals have not been tested for safety in the marketplace. And these include many of the chemicals that you probably are familiar with. I'll highlight some of them today, which are perfluorinated chemicals, flame retardants, phthalates, and phenols. These are also used either primarily or as an additive in plastics, which is a really important growth area in the US in terms of chemical production. So these chemicals are also known as endocrine-disrupting chemicals. These are chemicals that can interfere with the function of hormones through multiple mechanisms. And this disruption, particularly during susceptible periods of development, can increase the risk of many adverse health effects. This features some work that was done by Heal in Europe on how EDCs can affect female reproductive health, including early menopause, breast cancer, polycystic ovarian syndrome, endometriosis, infertility, irregular menstrual cycles. Other harms include impacts on male reproductive harms, increase in metabolic disorders, hormone-sensitive cancers, and neurodevelopmental harms. So oil and gas consumption has increased dramatically since the 1950s. And currently, petrochemicals account for about 12% of global oil demand, but they are on course to account for more than 1/3 of the growth in worldwide oil demand by 2030, and nearly half the growth by 2050. And we're seeing a shift in the use of fossil fuels to developing chemicals and plastics, as climate change activities are forcing a shift in the marketplace from using it in cars, for example, like the recent regulations that EPA announced about switching to electric, or decrease in power plant use. But the fossil fuel producers are just shifting the use of their product to a different type of use, which is this historical and projected increase in plastic production. So plastic production is predicted to grow by a factor of almost 3, from 400 million metric tons to 1,100 million metric tons by 2015. That means more products with more chemicals to which we will be exposed. So we already know that toxic chemical exposures start in utero. National and individual studies show over and over again that we're exposed to dozens of toxic chemicals, including the chemicals that we talk, PFAS, phthalates, BPA, flame retardants, etc. This is just one example of some study we did very early on in 2011 from using data that's collected by the federal government, showing that pregnant women are carrying at least 43 different chemicals in their bodies across the United States. And we also know that these chemicals exposures are not distributed equally. This is from some work that I did as part of the National Institutes of Health Environmental Influences on Child Health Outcomes, in collaboration with many other people, looking at not only familiar chemicals we know like BPA and phthalates, but also exposures to other types of chemicals, including phthalate alternatives and plasticizers and pesticides. And in this pilot study, we found that many of these chemicals are higher in Hispanic and Black pregnant participants compared to their white counterparts. And that's indicated by these upward arrows. Those are higher levels in Black and Hispanic participants. So the end result is what we're seeing due to some of these external factors is a shift from communicable to non-communicable diseases since 1990. I think this is really remarkable data. In 1990, communicable diseases, so that's things like AIDS, malaria, tuberculosis, had the highest share of the global burden of disease at about 50%. That has shifted since 1990 to 2019, which now non-communicable diseases, so you can think of those things as cancer, respiratory, cardiovascular, neurological, metabolic diseases like diabetes and obesity, now are the majority of the global burden of disease at 64%. That is a remarkable change in a short period of time. So that's not genetics, that's from external factors. And leading medical societies link the growth in chemical production as one of the potential risk factors for this increased growth. In the United States now, the increase between 1990 and 2019 in neurodevelopmental disorders, diabetes, respiratory diseases, and cancers increased between for different diseases, 28% up to 150%. So as I said, the chemical exposures in the plastic life cycles, you have natural gas extraction, which is becoming the dominant source of fossil fuel extraction in the United States due to the increase in fracking starting in around 2010. People can be exposed all along the processing, manufacturing, distribution, and disposal. So a lot of what I've been talking about is the products that we come into contact with, but certainly people who live in communities near these facilities are also exposed, and often at higher levels, to the products of the fossil fuel extraction and production and use. So I want to point out that when we're looking at risks to these chemical exposures, you have to also consider that risks can be modified depending on a number of different factors. Those factors can include extrinsic factors. So for example, socioeconomic status, discrimination, access to healthcare, food insecurity, also intrinsic factors like age, pregnancy, genetics, and sex. And these factors can interact and also increase or decrease people's resiliency to chemical exposures. So people who have lower income, less food access, have underlying disease status or of developmental exposures can be at much greater risk of exposures to a chemical exposure for an adverse health effect than someone who does not, who is maybe living in a higher economic situation and more health-free and an adult. So what we see is that this can additively increase the burden of disease, and these are the many different types of diseases that these chemical exposures can contribute to. And I want to make sure that this point is that means across the population, experts have concluded that there is no risk-free level of exposures to these chemicals. And that's really important when we're looking at regulatory and policy actions for addressing these chemical exposures. So this is where the convergence comes with being able to provide bottom line summaries of the evidence, which, just as an aside, the New England Journal of Medicine and a lot of these clinical activities have a very require that there be a rigorous systematic review before to make conclusions about evidence. And what's been really a big shift in the field is we do have a lot of high quality systematic reviews that have been conducted by many different groups, including the National Academy of Sciences, EFSA, which is in Europe, and US EPA, so that we can make definitive statements about the relationship between these different chemicals that many of us have worked on for many years: PFAS, phthalates, flame retardants, bisphenols, heavy metal, pesticides, and volatile organic compounds, which includes formaldehyde and benzene, to be known or likely to increase the risk of many different types of health effects, including metabolic disorders like phthalates and insulin resistance and diabetes, impaired neurodevelopment, BPA and effects on female reproductive health, heavy metals and male reproductive toxicity, pesticides and reduced sperm quality. And I wanted to point out that for formaldehyde, EPA is a relatively new risk assessment, finding not just cancers, but also neurological harm and female reproductive toxicity. So these are all health effects that are going up in the population. So the solutions are people can reduce exposures to chemicals, individually, but they have to be done through collective actions, including public policies, which are essential to reduce fossil fuels, extraction, production, and the use of petrochemicals. And while this has been recognized by these healthcare professional societies, I want to note that this is because of a lot of work that scientists and advocacy and environmental health groups have been doing to raise the profile of this issue. There's a lot of opportunity to improve health. We have already reduced the levels of the 6 common air pollutants by a lot since 1977 because of the Clean Air Act, while at the same time increasing gross domestic product and the population. And EPA is actually on track to have probably their most productive regulatory year this year since the PM 2.5 standard. They are announcing reducing PFAS in drinking water. They have new work they're doing on phthalates and cumulative risk. I actually didn't include, they just announced they're doing a new power plant rule, and they've also new rules to reduce air toxics. So there's an opportunity to focus on fossil fuel, reduce them and toxic chemicals for a win-win. So in conclusion, environmental chemical exposures are ubiquitous and they adversely affect health, and that those health effects are inequitably distributed. And fossil fuels contribute to climate change and petrochemical productions, thus increasing disease. So reducing fossil fuels, so public policies that focus on reducing fossil fuels can reap a double benefit for climate change and improved health. And that scientists and healthcare providers, along with community partners, are critical for supporting this systemic solutions in order to improve health and for all. So I'd like to thank everyone and the Program on Reproductive Health and the Environment and the Earth Center, and you can follow us on our social media channels. Thank you.
Thank you for that, Dr. Woodruff, and for walking us through your article and starting to outline what we need from public policies, which transitions nicely into the State of the Science report that our next speaker will be talking about. So I'll hand it over to Dr. Monclús now. Thank you for being here.
Thank you, Sarah, for the nice introduction, and thank you also for inviting me today. Let me share my screen. Okay. Okay. Yeah, sorry for that. Yes. So, hi everyone. Today I'm going to present the report that we published some weeks ago. This is a PLASCHEM project. It's a state of the science on plastic chemicals, where we identify and address the chemicals and polymers of concern. So allow me first to show the report. You can find it following this link. And there you also will find the database that is accompanying this report with all the data that we compiled for this project. So before going in deep into the key findings of this project and also the policy recommendations that we suggest, I would like to first introduce what are plastic chemicals. The chemicals are an intrinsic feature of plastics. All plastics have chemicals in it, and plastic chemicals are released through the life cycle of plastics, from feedstocks to the waste, going from raw materials, bulk materials, the products, etc. And they are not only additives. We are all the time hearing about additives, but there are many other types of substances that we call plastic chemicals. We have starting substances, we have processing aids, and we have the non-intentionally added substances, the NIAs, which are, for instance, the degradation products. And all of them are relevant for the human health and for the environment. So all of them is what we call plastic chemicals. And now you may know about the negotiations that will take place in 2 weeks in Ottawa. There is a huge momentum to address the plastic problem. This is an image of the UNEA 5, where there was a resolution to end plastic pollution. So many policymakers understand that we need a systematic change, and we need to include the chemical dimension of plastics in this plastic treaty to bring a vision for a safer and more sustainable future for plastics. And why chemicals are needed in the plastic treaty? Why do we need them? Well, we know and we have heard a lot about some chemicals like bisphenol A, like phthalates, some flame retardants, PFAS, but they are only the tip of the iceberg. We have many more chemicals that are in plastics. If UNEP published a report in 2022 where they identified more than 13,000 chemicals. And many of them, we don't even know many of their properties. Also here we can see that only 128 plastic chemicals are currently, are regulated internationally or nationally. And that means that many plastic chemicals escape regulatory control simply because we have too many and because no individual country has sufficient capacity to deal with them. So what we need is a paradigm shift toward a pragmatic approach to deal with this immense universe of plastic chemicals. So with this background, we took 2 main decisions in our project, and we decided to take first a hazard-based approach. And following a hazard-based approach, our main goal of this project was to identify chemicals of concern in plastic based on their intrinsic problematic properties. And this is based on 3 main concepts. First of all, we do not want any hazardous chemicals in our plastic that we use. We do have abundant evidence that these chemicals in plastic, they release from the plastic. That means that we, as humans, we are exposed to these chemicals and also the environment, and there are many effects related to these chemicals. And the hazard-based approach contrasts to the classical risk-based approach. So for this hazard-based approach, we follow 4 hazard criteria, what we call PVMT. So if you go and you follow this link and you go to this database, you will find that we are using different scores for these 4 criteria, and also one score for the sum of these criteria. And what we intend to show with this is if the chemical is persistent in the environment, if it's able to bioaccumulate, if it's mobile, and also if it's toxic. So the second approach that we took is a group-based approach. And with that, what we wanted is to address groups of chemicals instead of individual chemicals of concern. So in a timely manner, we cannot go chemical by chemical to check on them because we simply do not have the time. Also, there are chemicals that have similar structure and possess also similar hazard properties. So basically, our intent was to group them in groups that facilitates the management of the chemicals, also incentivize safe by design products, and avoids the regrettable substitutions. And so following these 2 approaches, in our Plastium database that you can see, we identify more than 16,000 plastic chemicals. And that's more than previously known. I showed you before that UNEP in 2022 identified 13,000. In 2024, we are identifying 16,000. Basically, we are building on the UNEP database. We use more sources and information was updated. And what is important is that not all of these chemicals are additives. So in this database, what we are highlighting is the multiple functions that the chemicals have and the complexity of the chemical dimension of plastics. So in addition to the well-known additives such as the plasticizers, flame retardants, we have many more types of chemicals. We have colorants, we have monomers, we have processing aids, and then we have these NIAs that I was telling you about. In here, it is in the other functions. And all of them are relevant for human health and the environment, and this is key. So if we take a closer look to this database, despite all these 16,000 chemicals are identified are used in plastic, we could find additional robust evidence for the use or the presence of these chemicals in plastic. So we have this robust evidence for 6,000 chemicals, and many of them have been detected in scientific studies doing some leaching studies, for instance, with the plastic. For the remaining 9,000 chemicals, we simply do not have this information, and that shows that we are lacking transparency on the plastics chemicals. If we take a look at the regulatory status of these chemicals, we updated our sources and we end up identifying 980 chemicals that are currently regulated globally under any multilateral environmental agreement. It is important to highlight here that many of them are only regulated during parts of the life cycle. For instance, in here we include the Basel Convention that only covers the plastic waste. So among all of these 16,000 plastic chemicals, we then, following this hazard-based approach and these 4 PVMT criteria I was telling you about, we identified the chemicals of concern. That means the chemicals that have hazardous properties. And if we take a look at this pie on the left side of the slide, we can see that we have more than 25 of our chemicals that are hazardous or are of concern. For more than 10,000 chemicals, we do not have any hazard information, so we don't know if they are of concern or not. And only for 161 chemicals, so that means less than 1%, they are classified as non-hazardous. However, they are not classified for the 4 criteria I was telling you about. So that means that on a scientific perspective, we cannot consider them as safe chemicals. If we take a closer look at the chemicals of concern, we can see that almost all of them are toxic. 4,184 chemicals are toxic. Half of them are toxic for the aquatic environment, half of them are toxic for human health. And here, for instance, we can see CMRs, and those are the substances that are, for instance, cancerogens, so that can cause cancer, or also that are toxic for reproduction. So out of these, all of these chemicals, we now have this hazard information, and what we wanted is to classify them, to organize these chemicals, to make it a bit easier to understand what we need to do. So first, we identify these chemicals that are already regulated internationally, what we call the MEA list, and this is these 980 chemicals. We then also classified and compile all the chemicals together in a gray list, all the chemicals that we do not have any hazard information. So we just took it in this gray list. And then we focus on the chemicals that we do have hazard classification, and we classify them in this 4 list. So the first one and the most important is the red list, and that has all these chemicals of concern that are not currently regulated under any MEA. That is 3,600 chemicals, and those are the chemicals that we recommend for further prioritization for regulation. We then have the orange list and the white list, which contains those chemicals that are either less hazardous or under assessment. So it needs to be prioritized for further evaluation or at least watch. And finally, we have the white list, which have these chemicals that are classified as non-hazardous. But again, the evaluation of these hazard properties is incomplete. That means that they should be prioritized for further assessment. So, okay, we have this list for single chemicals, but we also say that we wanted to do it in a group-based approach. And for that, we took all the chemical individually and we grouped them. And we group them based on their chemical structure. And we end up classifying or grouping more than 10,000 chemicals. Once we have these groups, we combine this information with the hazard scoring to identify priority groups of plastic chemicals. And we ended up with 15 priority groups. We see here some of them that are more known, like the bisphenols, the phthalates, PFAS. Those are groups of chemicals that we already know they are toxic, but we have other types of groups of chemicals that are less known. For instance, the aromatic amines. And if we look at the information, all the chemicals that were classified in this group or aromatic amines, all of them are hazardous. So based on all of these results, in this project, we try to recommend some policy guidelines that, well, the policymakers may wish to consider when addressing plastic chemicals of concern. So the first big statement is that we have many chemicals. So we need to comprehensively address them and efficiently regulate them. So we need to adopt a hazard and group-based approach. We need to apply these 4 hazard criteria that we suggested and address these 15 priority groups of chemicals and these 3,600 chemicals of concern that they are not currently regulated. Secondly, we have many unknowns. So that requires transparency on plastic chemicals. We need a unified approach for reporting such information. And we need also that the chemicals of concern should be labeled on across value chains and importantly on products. The third one is that we have a chemical complexity. We have many chemicals with the same function, different functions for the same chemical. We need to simplify plastics towards safety and sustainability. We need to develop clear guidelines and goals for achieving chemical simplicity in plastics. And finally, but not less important, we also need to build capacity. We have a capacity lacking, and it's very important to do it internationally. So we can create different frameworks for cooperation. We need to create a capacity for safer and more sustainable plastics. And with all of that, it was a lot of information that I tried to compile in this, hopefully 15 minutes. So here I leave you 3 main key findings or take-home messages. So we have many plastic chemicals. More than 3,600 are of concern and are not regulated, but we do have tools and mechanisms, and there is a scientific framework that is ready to be applied to identify and prioritize plastic chemicals of concern and help during these plastic negotiations. So just to finish, I would like to also highlight all the team under PlastChem project. It was really, really a team effort. You here have the link to the project, my email if you have questions, and thank you very much.
Thank you, Dr. Monclús, for that excellent presentation. And before we jump into the panel discussion, just a reminder that the audience Q&A will be right after that. So feel free to send in your questions now or at any point before that. So I'll hand it over to Kristen to get us started with the panel.
Great. Thanks so much, Sarah. And thanks so much to our speakers, both for your important work and for sharing it with us today. It is a lot, as Laura said, and so it's a little overwhelming, but I'm excited to dive in with you all for a conversation. My name is Kristen Schaefer, and as Sarah noted, I'm CHE's director. We're very happy to be co-hosting this discussion with CHE Alaska today. So before diving in for a brief panel discussion, I wanted to mention that this webinar is part of a series of conversations that we've hosted about plastic chemicals, starting with a webinar back in May of last year before the second INC, International Negotiating Committee meeting for the Global Plastics Treaty. And as you know, we're now heading into the INC 4 in Ottawa. So our team felt that helping to highlight the latest science about the life cycle health harms of plastics would be an important contribution to those discussions and to the broader conversation about the plastics problem. So our goal has been to make it very clear that plastic production is a driver of climate change and an urgent environmental justice and public health issue, and that bold and courageous policy changes are needed to address these risks. As Tracey noted in her presentation, the scope of this problem is a bit staggering. We'll drop links to the recordings of those past webinars into the chat now, and you can also find them in the slides and resources section of the CHE webpage for today's discussion. So with that, I'll kick off the Q&A session with a few big picture questions and then pass back to Sarah to moderate questions from you all, the participants. Thank you for being with us today. And thanks to those who've already dropped questions into the Q&A. And again, we invite others to do the same. So Tracey, I'll start with you. Your review article underscored both the breadth and the urgency of the problem posed by fossil fuel-derived EDC chemicals that undermine our health. Yet a lot of the science documenting those health harms we've known for a long time. So not an easy question, but my big picture question for you is, how did we get here? And more importantly, what are some key steps you think are needed to move us toward better public health protections?
Right. Thank you for the question, because I also talk about this in the article. And one of the reasons we're here is because we do not have sufficient laws that require that chemical companies tell us where they're using the different chemicals and what are the health hazards before those products are used in the marketplace. Now, I know I can just talk about it in the United States, chemicals that were on the marketplace in 1976, that's the vast majority of the ones that we're talking about. Those do not have any requirement to provide health and safety data to the U.S. Environmental Protection Agency, nor do they have to tell us where they're being used. And so you pretty much, and the government has a very laborious process now with the update of the Toxic Substances Control Act to kind of track each one down. And go through a very lengthy process before they can be regulated. So it's the opposite of the way pharmaceuticals are dealt with pretty much everywhere in the world, I think, which is they have to have all their data submitted and approved before a pharmaceutical can be prescribed in the marketplace. So that is the number one reason why we don't know, nor are these been addressed, because the burden is on the public and the government to identify the health impacts. And that is in large part because that's the way that the chemical companies like that process. It works out well for them. They can make a lot of money off of their chemicals before any type of regulatory activity happens. I think you see, and they do actively, in many cases, obscure the science or lie about the health effects of their chemicals for decades. Perfluorinated chemicals is now a classic example of how the chemical companies, Dow, DuPont, knew about the health effect harms of their chemicals decades before we did. So those, I think, are the big contributing factors. I think if I don't think that in the United States, the paradigm is going to shift too soon, but I think one of the things that's really been helpful is that a lot of the collective information and science that's been happening, and that advocates have been very, very active in promoting this issue, and the healthcare community, they inevitably will have to address this because they just are seeing too many increases in these chronic health conditions and too many unusual, complex health diseases that you have to look to other factors. I mean, there's other changes that have happened, for example, the growth of ultra processed food, but certainly chemicals are an important contributor to that. And I just want to say there is new methods that people have been using to try and more rapidly identify health effects through like in vitro and in silico approaches, like using computers and small. And I think those systems hold a lot of promise. There's always going to be a barrier to getting them out of the marketplace in terms of the regulatory process under the way the laws are set up. It's pretty slow.
Yeah. Well, thanks for that. And yeah, your point is well taken that we're getting to the point where it's too big a problem to ignore, that there's just so much evidence linking these chemical exposures that it's going to drive us toward that paradigm shift that we need. So Laura, I want to turn to you, and the PlasChem report outlines a lot of recommendations, and you went over them in your presentation, and I have a question about prioritizing. So you recommend recommendations for new, more effective ways to regulate plastic chemicals, including using the hazard and group-based approaches to identify actions needed. You and your co-authors also recommend reducing unnecessary uses and adopting essential use and safe by design guidelines to spur innovation. So which of these do you think negotiators at the upcoming plastic treaty meetings should prioritize given the urgency of the problem?
Thanks, Christine. Well, this is a very important, very interesting question, I would say. In our report, we try to translate the scientific findings into concrete and actionable considerations for policymakers at a local, national, and international level, which resulted in these 4 recommendations. And I would say that all of them are interlinked to each other, and all of them are important to be considered and to be performed at the same time. But if you ask me to prioritize, maybe perhaps the most urgent action due to the high number of substances of concern that we identify would be the first recommendation, would be to regulate the plastic chemicals of concern, to apply hazard-based approach, apply group-based approach to identify them, apply the 4 hazard criteria, and that can be extended as well. As one thing that I didn't have the time to go in deep in this presentation, as we talk about aquatic toxicity about the environment, we didn't talk about terrestrial toxicity. We still do not have terrestrial toxicity included in this hazard criteria. So this is something that needs further studying and work. But only regulating these chemicals of concern is only touching the tip of the iceberg of the problem. And we need a more upstream and more general coverage of the problem. And that's why we have the other 3 recommendations that needs to be done as well. Here, adopting essential use, adopting safe by design guidelines would certainly help. One could ask, for instance, by asking why plastic products are necessary and why some of them are not necessary. We may have alternative materials, alternative process being available. Maybe we could innovate and create products that have less hazardous substances. And then when plastics are essential, the next question is how we can remove the groups of hazardous substances to make the plastic safer, so they are more compatible with a circular economy. But at the same time, we require transparency, because we still do not know the chemicals that industry add in the plastics, and we need to know that. We also require simplification. We have too many chemicals with same functionality, and all of that works towards the same direction, which is safety and sustainability. And also something very important is working towards building capacity. We need to create these more safe by design products, but we need to do that establishing international cooperation. We need to allocate resources to the different globally. So the knowledge, the infrastructures that we create are open, are fair, are equitable. So I would say at the end, my conclusion is all of them are necessary. And we need science to assist us in front of this. Yeah, thank you.
Great. Yeah, no, thank you for that. And yeah, it's interesting. I think the concept of essentiality seems really key. Like what of these products do we really need? And starting to, again, that paradigm shift can move us toward reduction of this huge levels of production. And also the simplification, just the number of chemicals is so staggering. And often with, like you say, duplicate purposes. And so toward regulation and simplification, that seems like an important step for these conversation as well. So I have one more question before handing it back to Sarah. And again, this is another big picture question for you both. And Tracey, let's start with you. So again, while addressing the human health harms of chemicals and plastics can feel overwhelming, it does seem, even in the last year, that this problem is gaining recognition, that plastics are now seen as not only a source of pollution, but also a public health issue. And so my question for you both is, are you hopeful that we'll be able to effectively address this problem? And you both touched on this, and I saw optimism in both of your presentations, but why or why not? And yeah, love to hear your thoughts on that. So Tracey, let's start with you.
Yeah, sure. You know, it's so interesting we're talking about this because there was recently a book published that is a history of the making of the 1964 Surgeon General's report on smoking. So people know that was a groundbreaking report. It identified smoking as a carcinogen. And when you look back to see how much people were smoking back then, it was huge. I mean, people were like hundreds of cigarettes a day. It was tobacco was a huge part of the economy, including in southern states. And it had all the same things about plastic, lots of use, big part of the economy, regulation, or it wasn't even regulation, announcing they were bad for you was going to make a big shift. And you know what? We did make a big shift. And the thing that happened was people got healthier and, you know, the economy moved on to other types of, okay, maybe plastics was not the consequence, but I'm just saying that there are other ways that the economy can still grow, people can still have jobs, and we can be healthier. So I think that because I have a lot of hope because people have recognized this and that there's a lot of groups working on it. I think the other thing we can learn from tobacco is that when the public health community works together with the healthcare community and scientists, even if they are outspent, which is the case here as well as with tobacco, eventually they will make progress because the truth, you know, is important. Of course, I know we have like a little problem with truth right now, but I do think that makes a big difference. So I think the fact that people are collectively working on this and bringing up the issue, and people you know, people who are not scientists or whatever on the ground, they totally get it. They get that the companies are not working in their best interests. They get that there are these weird health effects that they're observing in their community, and they know that it's not because of themselves being blamed. So I think that, yeah, it's not like it's going to be easy, but I do think it is doable.
Right.
So,
And it's great to have, thanks for sharing that, we've done something similar. It's great to have an example to look
yeah,
back
I
on.
can't
and
remember
it's-
how many I was smoking, but when I looked at the numbers, it was staggering how much. I mean, I think it was like 30% of the GDP was tobacco.
Yeah. Yeah.
I mean, that's huge.
Mm.
And now, I don't know, you can't really
Much
do anything, you
smaller.
know?
Yeah.
So.
Yeah. No, really, really interesting example. Laura, what are your thoughts on, do you feel hopeful, and why or why not?
Yeah, I totally share the same spirit as Tracey. I would recall exactly what you said. Really like it, the tobacco example. I think we have two main things. We have the momentum, we have the awareness. People know now what is happening. Maybe back in the days, it was easier to focus on pollution that we could see, like marine litter, for instance, but and not so much on the pollution that one cannot see really, like chemicals, right? But we are now more and more aware, and people start talking about, using this type of plastic for kid toys, for instance. I have many friends that try to use other types of toys because they don't want to expose the kids to plastics. So society now knows what's happening with the chemicals in plastic. Policymakers are also aware of the problem, and there is now this big momentum in the plastic treaty where they sit and they discuss and they hear what different knowledge. I don't want to say scientists only, because there are many others stakeholders that can provide also knowledge that is important. So they also listen to it. And so I think that for on one side, we have this big momentum of knowledge, and on the other side, I am very positive that we have the tools to accomplish that. We have the science, we have the evidence-based approaches that we can use. It has been used in the past. We have different examples, and I think that we have the mechanisms to make it work. So I'm very positive as well.
That's great. Thank you for that. And thanks to both of you, because I think the work that you do as scientists is really an important piece of building that momentum and that awareness and moving us forward. So really appreciate the work that you do. So Sarah, I'll hand it back to you to move us towards the questions from the Q&A.
Thanks, Kristen. So now moving into our audience Q&A part of the webinar. We already have quite a few questions, and maybe we could start with one. I think Dr. Woodruff, you already typed an answer to, but I think it would be good to share it with other participants. So the question is, should we talk about having reduced PFAS in water when EPA measurement is only of some PFAS in water systems, and many more PFAS are being used and manufactured, and many water systems have not yet been measured for those? Given possible additive effects between various PFAS chemicals and between PFAS and other toxic chemicals, it seems to underrepresent the magnitude of the problem and the level of progress we're actually making. So this could go for either of you.
Yeah, I just want to say, yes, agreed. EPA's announcement today is to enforceably regulate 6 PFAS in drinking water. And I think there's 12,000, 14,000. I don't know, the number keeps going up on the EPA dashboard, but I think it's 14,000 PFAS chemicals. So certainly EPA has, or the federal government has, much more to do in terms of regulating PFAS, as well as other toxic chemicals. And also looking at them together as a class is really important. Now, I will note that the new drinking water standard does look at 4 of them together, aggregate 4 of them together in a more cumulative risk type framework, which is actually a big step forward, because the ones that they put together don't move beyond where EPA has been in terms of requiring the same mechanism of action. So I think there's a lot of positive movement at EPA right now around being a little broader about how they're looking at chemicals adding together. Does not mean they're like, though, they still have a lot to do, for sure. But the other comment I was making about EPA is that the number of regulations that we've seen come out of this administration in the last month is probably more, because I used to work at EPA. I was just talking with someone from EPA. It's probably more than they've done in 20 years. Now, again, is that a good, should they have been doing more? Yes, they should have. But I think it just means that there's a shift in the momentum of looking at to EPA to do work on everything from climate change to, like also the rulemaking they just did on the toxic air contaminants. So I think we want to encourage them to do more of that. That's my recommendation.
Thank you. And then on to another question from an anonymous attendee. They said, can someone explain why so many chemicals are endocrine disruptors? What is it about all these chemicals that make them work this way in human bodies?
That's a great question. I think the reason is that there's a couple things. One is to be an endocrine disrupting chemical, you can alter many different types of mechanisms in the body. So sometimes it's affecting so hormones are like made in one place, they travel to another place and they lock in, and then that creates a signal that then says, go do something in the body. And so there's ways to disrupt that along the path line. It could be not as many of them are made. It could be that the receptor is, either there's more attaching the receptor less, but there's other kinds of downstream mechanisms that have been linked to endocrine disruptors. So like changes even in epigenetics and cellular changes. So I think that a lot of chemicals fall into this category of having these types of mechanisms, making them endocrine disruptors. So it's a pretty broad category. I agree with that. But a lot of I think chemicals have I think one chemical can have many different ways that they influence mechanisms in the body. Endocrine is one. They could also alter genetics that can contribute to cancer. So that's probably where using a category to encompass something that's kind of complicated, but I think a good pneumatic for thinking about these ways that chemicals can affect biological systems.
Thank you. Yeah. Another question, what would be the best way to promote creation of safer, more sustainable plastics? Is the white list a place to start? Maybe more for Laura, but feel free to answer.
Yeah, that's a very good question. This white list is what it is not, but it was what it was intended to be, like kind of a positive list where we try to identify if we could find any safe chemical. As I said, because these chemicals did not fulfill all the 4 criteria, we cannot say that. So I would say that promote creation of safer, more sustainable plastic would be those ones that are compatible with circular economy. We want circular economy, but at the same time, we don't want to recirculate hazardous substances in our products, right? So we have this polemic dilemma that we don't want to contaminate the environment, but also we don't want to expose ourselves to hazardous substances once in this circular economy. So I think that here we need to incentivize simplification. As I was saying, we need less chemicals to begin with, so we can work with them in a better way. We need to know, we need transparency to understand which chemicals are they, and also to be able to also study their potential hazard properties. And then we also need innovation of the products and maybe new technology to produce these new products with high quality materials and also that can go towards this positive list, right? Trying to have this that they contain these chemicals that we know that they are not hazardous. And we could do that in a way that these products could also have kind of maybe a QR or an index where we could see which chemicals they have. So we could trace them and we could know that they are safe or not towards the human health and also the environment. So that could be one way to go.
Thank you. Another question for Laura. Have you identified high priority workplace plastic chemicals for which there are no workplace standards or regulations?
So plastic chemicals that they have no regulations, mean?
Yes, like high priority.
Yeah, sure. Yes, we have identified many of these chemicals that are hazardous, that they are not regulated globally. Something that we have also checked in this project or in this report is like regional regulations or national. So we took into consideration the California P665 list and also ECA list, and also from Japan and Korea. And we found that some of these high purity chemicals that are not regulated globally, but they are regulated regionally or nationally in some areas of the globe. Yeah.
Thank you. Maybe we'll go back to another question that was already answered, but are the chemicals / oil and gas industries attempting to dispute the adverse health impacts as the tobacco industry did?
Yes, that's the short answer. So yeah, we see there's a lot of documentation of ways that the oil and gas industry has obfuscated science. Cover a little bit of that in the New England Journal of Medicine article. Certainly there's been some excellent work looking at how Exxon hid the facts of how fossil fuels are contributing to climate change for many years. But we're also seeing, if you go on the American Chemistry Council's website or Exxon's website, that there are a lot of written items about how some of these chemicals that I talked about, like BPA and phthalates, are not really all that toxic in their ways that they are trying to obfuscate the science. And I just say for PFAS alone, we wrote a paper showing that the manufacturers knew about the health harms of PFAS for decades. So I would recommend, we have an excellent library at UCSF, Industry Documents Library, that collects documents, internal documents from many different types of industries, including the tobacco industry. Started with the tobacco industry. And in those documents, you can see how the tobacco industry works cross industry to promote some of the tactics they use to decrease the people's access to science, as well as interfere with the regulatory process.
Thank you for that answer. I see we're slightly over the hour, so I think that's all the questions we have time for. Thank you, Dr. Woodruff and Dr. Monclús, for being here and for your insights in this discussion. And thanks to all of you for tuning in and for your questions and comments. There were some questions about a recording, and a recording of this webinar will be available through the CHE website and the ACAT website. And it'll also be sent to your email inboxes in the next day or two. So thank you again, everyone, and we'll see you next month.